Welcome. This video is presented by the Northwest Pediatric Environmental Health Specialty Unit and the Washington State Department of Health Childhood Lead Poisoning Prevention Program. This video is intended for clinical staff who will be using the LeadCare 2 device, performing capillary blood lead testing, and/or reporting results to the Washington State Department of Health. In this video, we'll review the following: the importance of lead screening and testing, how to perform capillary blood lead testing, how to use the LeadCare 2 device, how and when to report blood lead test results to the Washington State Department of Health, and case management for children with an elevated blood lead level. The Northwest Pediatric Environmental Health Specialty Unit, or Northwest PACU, is a nonprofit organization based at the University of Washington. Northwest PACU works closely with the Washington State Department of Health Childhood Lead Poisoning Prevention Program, also known as Washington DOH CLIP, to educate providers and families about the importance of lead screening and testing to improve children's health. Childhood lead poisoning prevention is an important part of pediatric care. Even low levels of lead in a child's body can negatively affect their developing brain. Low-level lead exposure early in life is associated with an increased risk of developing certain health conditions, such as learning and behavioral challenges. Because children's bodies are still growing and developing, they are more vulnerable than adults to the toxic effects of lead. Children exposed to lead are often asymptomatic, which is why screening and testing are so important. Early identification through blood lead testing helps reduce the risk of long-term harm so children can reach their full potential. Blood lead levels are measured and reported in micrograms per deciliter. In the United States, a blood lead level greater than or equal to 3.5 micrograms per deciliter, the CDC's blood lead reference value, need follow-up care. Providers are required to order a blood lead test for all children covered by Medicaid insurance at 12 and 24 months of age, or at least once by the age of 6. If a child is covered by a different insurance in Washington State, their healthcare provider should work with the family to see if the child is at risk of lead exposure using the Washington DOH blood lead clinical algorithm, and if so, order a blood lead test. As of spring 2026, the only device that is CLIA waived and approved to use for point-of-care blood lead testing is the LeadCare 2 blood lead analyzer. The LeadCare 2 requires a small sample of capillary blood from a finger or heel stick and provides results in only 3 minutes. This video will not cover all aspects of using this device, such as how and when to perform quality control testing or troubleshooting issues. For more information or assistance about the LeadCare 2, visit the manufacturer's website or instructional video. Once a point-of-care test has been ordered by the healthcare provider, or if you have the license to use the Washington State Blood Lead Testing Standing Order, check if other capillary labs have been ordered. It's safe to poke once and use a single site to collect capillary blood samples for multiple tests. However, the lead test blood sample must be collected first to prevent sample contamination and false positive blood lead test results. The sampling site, finger or heel, and the size and style of the lancet used depends on the age and size of the patient and what is available and most commonly used at your clinic site. Generally, a finger stick is most appropriate for infants and children 6 months of age and older. We recommend gathering and setting up all of your supplies in advance so the collection process goes smoothly. In the room with you, you'll need a clean working surface on which you can put your supplies, access to a sink to wash the child's hands with soap and water, gloves, alcohol wipes, gauze pads, lancets, a bandage, biohazard container for used lancets, and the LeadCare 2 test kit materials, which include a glass collection tube, plastic treatment reagent container, and black plunger. When it's time to run the sample, you'll also need the LeadCare 2 device, a sensor strip, and a plastic dropper. The sensor strip and plastic dropper are also included in the LeadCare 2 test kit. Another important step to prevent sample contamination is proper skin prep. Preparing the skin for a lead test is unique because instead of simply cleaning the skin with an alcohol swab, a patient's hands must first be washed with soap and water and left to air dry. It is important that you do not dry the hands with a paper towel or other materials, as this increases the chance for contamination and getting a false positive result. Do not let the patient's hands touch other surfaces or clothing between hand washing and sample collection. It can be challenging with young children to have them avoid touching anything while waiting for their hands to dry, so you may want to ask for assistance from the child's caregiver or another clinic staff member. Once the hands are washed and dried, the child should be positioned in a way that's most comfortable for the child and caregiver, so long as you can easily access the sample site. Wipe the chosen finger with an alcohol swab and let it air dry. Lance the finger with the lancet. If successful, a drop of blood will form at the skin. Always wipe or dab the first drop of blood away with a piece of sterile gauze, as this is another way to decrease any chance of sample contamination. After wiping away the first drop, use the glass collection tube provided in the LeadCare 2 test kit to collect the blood sample. Some helpful tips for sample collection are to hold the end of the tube with the green stripe. Hold the tube horizontally at a slight angle. The tube has a vacuum effect that will pull in the blood. Allow a drop of blood to form before touching the tube to the blood. Hold the tube away from the finger until an adequate drop of blood forms. If the tube is continuously held against the finger when there isn't adequate blood volume to fill it, air bubbles will form in the tube, and this can lead to an inadequate sample. Do not aggressively milk or squeeze the finger, as this can cause the sample to hemolyze and may affect the results. To ensure adequate blood volume, try techniques such as warming the finger beforehand and using gravity to improve flow. Once the blood fills the tube to the black line, the sample collection is complete. You can then have the caregiver or other staff member hold a piece of gauze on the child's finger or apply a bandage. After the sample is collected in the glass collection tube, transfer it to the plastic treatment reagent container supplied in the LeadCare 2 test kit. To do this, open the plastic treatment reagent container, hold the glass collection tube vertically inside the container, and push the black plunger into the glass collection tube, so the capillary blood sample is expelled into the reagent container. Now, close the reagent container and invert it 8 to 10 times to mix the capillary blood sample with the reagent. You'll know the sample is ready when the mixture turns brown. Ensure that the reagent container is labeled appropriately with patient initials or other identifiers your clinic decides to use, especially if the sample is not going to be run immediately. Wait to discard the reagent container mixed with the capillary blood sample in case an error occurs and the test needs to be rerun. To run the sample on the LeadCare 2 device, take a sensor strip from the kit and insert it with the black bars first into the device. The device will beep when it's fully inserted. Next, pinch the top of the plastic dropper and insert it into the reagent container that's been mixed with the patient's capillary blood sample. Release your pinched fingers so that the sample is drawn up into the dropper. Touch the dropper tip to the X on the sensor strip and squeeze the dropper to dispense the sample. The device will beep once an adequate amount of the sample has been dispensed onto the sensor strip. The device will then begin immediately analyzing, which takes 180 seconds. When it's done, the analyzer will beep and the result will display. The results will be displayed as one of the following: low, which means the result is below 3.3 micrograms per deciliter, the machine's low limit of detection. A numeric value between 3.3 and 65 micrograms per deciliter, or high, which means the result is above 65 micrograms per deciliter, the machine's high limit of detection. The healthcare provider should be notified of any result at or above 3.5 micrograms per deciliter. The Washington DOH recommends providers to order a confirmatory test to ensure that the result is not a false positive, preferably with a venous sample. Speak with the ordering provider to ask about confirmatory testing. Very high lead levels, 45 micrograms per deciliter or above, are treated as an emergency and often require hospitalization. Although these high levels are rarely seen in children in the United States, it is critical to report very high lead level results to the ordering provider immediately. It's important to note that the LeadCare 2 device does not communicate with any electronic medical record. In other words, the results you see on the device will not automatically be uploaded into the patient's chart. Results must be manually entered into the patient's chart. All blood lead level results are required to be reported to the Washington State DOH. The requirement to report blood lead test data comes from the Washington Administrative Code, Chapter 246-101 WAC. Results at or above 5 micrograms per deciliter must be reported within 2 business days. All other results under 5 micrograms per deciliter must be reported within 30 days. Work with your clinic management and staff to determine who in the clinic is responsible for reporting the results. Facilities using LeadCare devices are considered labs under the State Notifiable Conditions Rule. If you don't report or don't know if your data is getting reported, please contact lead@doh.wa.gov for assistance. One of the reasons reporting blood lead test results to the Washington DOH is important is because the local health departments will be notified of blood lead results at or above 3.5 micrograms per deciliter and may respond to blood lead cases in their jurisdiction. Depending on capacity and resources, the local health department may be able to provide families with case management support. The goal is to help families find the source of lead that the child's being exposed to and stop or limit their exposure. We hope this video has helped familiarize you with the process of point-of-care blood lead testing and reporting. To access free materials, both print and online, on the topic of childhood lead poisoning prevention, or for more instruction on blood lead testing and reporting, please visit the materials and resources linked at the end of this video.